I welcome Professor Abdel Basset Elessawy for MedEdge podcast. A warm welcome to you, sir. Let's start with a brief introduction about who Professor Abdel Basset Elessawy is and what does he do.
I am a professor of internal medicine and nephrology and at Azhar University in Egypt. And I'm in sabbatical leave, work as a visiting professor at Harvard and a scientist at the Brigham and Women Hospital. Parallelly, I work as a professor also on Faqih University Hospital in Dubai, as well as I'm a adjunct faculty professor at Sharjah University and at Ras Al Khaimah School of Medicine.
That's great to hear, sir. I'd like to know about diabetic kidney disease that you are specialized in. So if you could shed some light on that particular topic.
Well, diabetes is a very, very prevalent disease in the GCC countries. And the last data tells that in UAE, the percentage is almost 19% of the population diagnosed. And certainly, there are a certain percentage of population walking in the street have diabetes and not diagnosed yet. This disease is known worldwide to be the most common cause of renal failure worldwide. And so in this case, if you do the statistic among the dialysis patient, you will find the most common population have underlying kidney disease.
Okay.
And so there are too many ways to treat these people. First, the most important thing before to reach to the dialysis is to treat the patient with diabetes before and during the initial phase of developing diabetic kidney disease. And this is luckily recent 10 years, we have many medication which can help a slow progression of kidney disease in patients with diabetic or diabetic kidney disease. So the strategy now is to prevent those patients with diabetes who develop diabetic kidney disease from progressing to end-stage renal disease and doing either dialysis or transplantation.
I understood the treatment procedure like you mentioned, but let me jump before that and ask you what are the causes for this particular disease? And as people say, prevention is better than cure. How can people prevent this particular thing since this is very wide in the GCC?
Yeah, the first thing is to prevent diabetes. Before you prevent diabetic kidney disease, you have to prevent diabetes. And with the progressing technology now, we can diagnose the people in pre-diabetes stage. So one of the main cause of developing diabetes worldwide and in GCC country is lifestyle.
Okay.
So lifestyle include two things, exercise and nutrition. So people, especially who have a family history of diabetes, they have to know they are at risk of developing diabetes. So it is easily to identify those who have a family, father or mother or grandfather or grandmother who have diabetes, they will be at high risk to develop diabetes genetically. And this case, by knowing the history, they can adopt lifestyle in two parts, exercise regularly, and we don't ask them to exercise an affordable type of exercise. We ask them to walk every day on a regular basis, 30 minutes.
Okay.
This is exercise. Foods, it's better to avoid heavy meals, fatty meals, and make the vegetable and the fruits more than 50% of the constituent of their meals. And to always adapt low-fat meals, whatever's a milk product or non-milk product, to minimize the amount of fat and oil in their food. So lifestyle, regular exercise, simply walking, and type of foods. Make the majority of food vegetable and fruit. Avoid fatty meals.
Fatty meals in the sense those which are deep fried, etc. I believe.
Deep fried, using is butter and oil in cooking. It is usually delicious food. This is why the people go for. But in the other, it has to be minimized as much as possible. So like this, we can even revert not only diabetes, but revert hypercholesteremia, improve the blood pressure, reduce uric acids. So, and we have simple standard, well documented scientifically, if you reduce the weight by 15%, you can revert recent diabetes, recent hypertension, recent hypercholesterolemia, and recent hyperuricemia.
Very good that you shed light on the causes and how to prevent it from occurring in the because of the lifestyle itself.
And this is what I adapt in my practice. Last thing I do is to prescribe medication. I encourage people to go for lifestyle modification and reducing the weight. And I explain to patients, especially the young one who are in their 30s and 40s, imagine you start anti-diabetic or anti-lipids now, what will be happening after 40 years of using the medication itself.
We understood the post-treatment and the causes and its prevention. Let me ask you, if somebody fears they are having diabetic of some sort, so what is the best way to collaborate with the right clinical person?
Well,
How can they do it, or how to reach, or in the initial stages?
the problem here is the early referral.
Okay.
So the problem is most of the doctor doesn't refer patient with diabetes to the nephrologist of kidney disease doctor except when the kidney disease is progressed. Now we ask them to do early referral by measuring the proteinuria in the urine and measuring the glomerular filtration rate, what's called eGFR. If the eGFR reduce plus or starting having a proteinuria, in this moment there is a conflict between a nephrologist and other doctor treating diabetes like internist, family medicine, and endocrinologist when to refer or what to do. I recommend them to refer the patient early once they see the proteinuria or reduction of eGFR. They have to refer the nephrologist because they are the expert in dealing with such cases.
Thank you very much, Dr. Professor Abdel Basset, for shedding light on diabetic kidney disease and helping us understand how to prevent it and what are the causes. It is an honor to have you on the show.
Thank you. Thank you very much.